So, good evening already. Thank you very much for the opportunity to present my presentation, to practice my presentation today. And I'm very excited to now present you the first research of my thesis, which is on placental pathology and neurodevelopmental outcomes in very preterm-born infants. And I want to start with a problem. Why did we even do this research? Well, due to advancements in technology, survival rates of very preterm-born infants have increased. But what we see is that many grow up facing neurodevelopmental challenges, like minor to major cognitive and motor problems, and also really serious conditions like cerebral palsy. And what we've also seen is that these complications stem from a very young age due to injuries of the baby's brain. And what is believed is that the placenta plays a crucial role in this. Therefore, the aim of my study was to look at the association between placental pathologies and predictors of neurodevelopmental outcomes in very preterm-born infants. And these predictors are the general movements. Now, what these are spontaneous, complex, and variable movements that almost all babies do following birth. It's a diagnostic method according to the Gestalt perception because it's very helpful in identifying brain injury of these very preterm-born infants. And in the first 6 weeks after birth, they are called writing movements. But what I'm particularly interested about are the fidgety movements, which come in the 6 to 20 weeks post-term period. And these have been found to be the best at predicting neurodevelopmental outcomes. They are judged as atypical if they are absent, sporadic, or abnormal, and particularly the absent one, for example, have been found to predict the development of cerebral palsy with very high sensitivity and specificity. What we also used was the motor optimality score, which is a quantitative measure of the fidgety movements. This ranges from 5 to 28, and the higher the score, the more optimal the movements. Also, in a study with a cohort very similar to ours, a cutoff point of 23 points have been identified to be a very good cutoff point is predicting mainly non-cerebral palsy outcomes. So the babies that had a cutoff point under 23 were more likely to develop non-cerebral palsy outcomes. A bit about the study design. We included infants born at the UMCG under 30 weeks of gestation or with a birth weight under 1,000 grams. And then a perinatal pathologist analyzed the placenta samples according to the Amsterdam criteria. And we also made videos at about 3 months post-term that were later used for analysis of the fidgety movements. A bit about our cohort. Here what's important is to see how young the babies were and how light as well. Here you can see the median gestational age and the birth weight. What's also important to notice and to mention is that 9% of our cohort had intracranial hemorrhage grade 3 and 4, and 28% had sepsis during the admission. These are things we corrected for in the analysis later on. A bit about the placental pathology. So 85% of our cohort had at least one type of placental pathology. And then the most prevalent one in our cohort was maternal vascular malperfusion. This was present in 54% of the placentas. And this comes to the abnormal implantation with inadequate spiral artery remodeling, which leads to erratic and heterogeneous blood flow. Then, fetal vascular malperfusion was also commonly seen in 23% of the placentas, and this comes due to partial obstruction of blood flow that affects the entire vascular bed on the fetal side. Lastly, also ascending intrauterine infection was quite often seen, and the infection compromises blood flow and increases inflammation in the placenta. Now, a bit about the outcomes of the study. We found ascending intrauterine infection to be significantly associated with absent fidgety movements. And as I mentioned before, these are really good predictors of cerebral palsy. Therefore, we can interpret this by saying that ascending intrauterine infection increases the risk for cerebral palsy. But these results should be interpreted with caution. As you can see here, 100% of the babies that had absent fidgety movements, also their placenta suffered by this placenta pathology. and also the numbers of babies with absent fidgety movements were very low. Next, we saw that fetal vascular malperfusion significantly decreased the motor optimality score. As you can see here, from a median of 23 in the absence of FAM, the motor optimality score decreased to 21. But when we corrected for intraventricular hemorrhage, grade 3 and 4, and sepsis, this effect actually became non-significant. But the trend is still decreasing. So as you can see, the B is still quite low. Therefore, we can say that fetal vascular malperfusion leads to less optimal motor optimality score and therefore a higher chance for development of non-cerebral palsy outcomes. Next, we saw that both fetal and maternal vascular malperfusion were significantly associated with the motor optimality score under 23. This was the case in the univariate and also in the multivariate logistic regression, in which we corrected for the two confounders, the intraventricular bleedings and the sepsis. With this, we can say that both these placentas increase the risk for adverse neurodevelopmental outcomes, and we also consider this finding quite good for the clinic, as it's quite easy to implement. Lastly, we saw that an increasing number of placental pathologies showed by one placenta decreased the motor optimality score. Therefore, this was also a bit to be expected, as more damage the placenta, worse the perfusion, and worse the amount of nutrients that get to the baby. Now for the conclusions, we found 3 placental pathologies to be significantly associated with lower quality fidgety movements. But what is good is that with early identification, monitoring, and intervention, the outcomes can be improved. Therefore, we urge that neonatologists also look at the placental pathology analysis when creating a treatment plan for these vulnerable babies. Thank you to all the co-authors and my supervisor as well. Thank you.